Hello everyone, welcome to today's Instagram live. I'm Dr. Rida Joweriya from Kolors Healthcare. Today we are discussing a very common concern which everyone can relate to some extent, that is acne scarring. Hi everyone. Hello. Hi. Hi everyone. Hi. Yes, Ashokji, Ashok Garwan from Hyderabad. This is Hi Tripathi ji. Hi. Yeah, so we'll start the topic now. Hello everyone. Welcome to today's Instagram live. I'm your dermatologist, Dr. Rida Joweriya from Kolors Healthcare. So today we'll be discussing a very common concern that many clients or many patients of us have, that is acne scarring. So many people think acne scars are permanent and untreatable, but good news is that because of the advances in the modern dermatology, we have several effective treatments are available that can significantly improve their appearance. So let's understand what are acne scars. Okay. So, acne scars are the depressions that are usually left behind after acne heals. Usually, they develop when inflammation from the acne damages the deeper layers of the skin. So, what happens is body will try to repair చేయడానికి ట్రై చేస్తుంది body by producing aqua collagen. ఆ collagen ఎక్కువ ప్రొడ్యూస్ చేసేటప్పుడు ఏమవుతుంది, it will leave scarring. Okay. So, like many people have this query, ఒక ట్రీట్మెంట్ తో వై యాక్నీ స్కారింగ్ డెంట్ కమ్ డౌన్, ఇక్కడ ఐ హ్యావ్ మెనీ స్కార్స్. సో వై దిస్ స్కార్ హ్యాస్ రెస్పాండెడ్ టు ఈ ట్రీట్మెంట్, వై దిస్ స్కార్ డిడెంట్ రెస్పాండ్ టు దట్ కైండ్ ఆఫ్ ట్రీట్మెంట్. సో అది ఎందుకంటే acne scarring is like it has so many types of scars ఉంటాయి. కొన్ని ఐస్ పిక్ స్కార్స్ ఉంటాయి, కొన్ని రోలింగ్ స్కార్స్ ఉంటాయి, ఇంకా బాక్స్ స్కార్స్ ఉంటాయి, ఇంకా హైపర్ట్రోఫిక్ కీలాయిడల్ స్కార్స్ అట్లా కూడా ఉంటాయి. ఓకే. సో ice pick scars are usually they are very in a straight line, they are deeper scars and they are very narrow, and usually it happens when you pick on your acne or when you squeeze on your acne. So that is the reason behind it. So usually they are treatable by few procedures like TCA cross, etc. Then there are box scars. Box scars are like, they'll be more in the circumference, and they are wider depressions with, very well defined, the edges will be very well defined in those. Then, apart from that, we have rolling scars. There is wavy, uneven appearance of the scars will be there. So, and then there are last, that is hypertrophic or keloidal scars can also be present. So it doesn't mean that when you have one type of scars, you can't have the other type of scars. So, like few people have ice pick, then rolling, then box scar, and then different types of scars will be there. So to know why do we need to know what kind of scar you have? So the reason behind is the treatment, the approach to how we treat the scar depends on what kind of scar you have. See, ice pick scars will respond to TCA cross, like about the very laser atla. So box scars atla it will respond better to laser. So coming to the treatment part, if we see. So treatment part ante we have commonly used what treatments unnayante microneedling can be done. So microneedling can be combined with PRP therapy, that is platelet rich plasma therapy కూడా combine చేయవచ్చు దాంతో. ఇంకా microneedling with radio frequency ఉంది. And then we have erbium YAG laser, we have carbon laser, then we have TCA cross, which specifically on the where there are scars we can apply the trichloroacetic acid. Then there is subcision, which is usually done for rolling and box scars. Then chemical peels can be tried, PRP can be tried. Then in few cases we can even try, after subcision or after doing these procedures, we can fill the scar through dermal fillers. So these are the different procedures that we have. Hi, hi. Yeah, hi. I have tried to cover up scars ఎందుకు వస్తాయి, like scars procedures ఏమేం చేయవచ్చు, ఇంకా scars, what are the types of scarring. So if you have, how many of you are suffering from acne scarring? Can you guys please comment what type of scarring you have? What myth or what doubts మీకు ఏమున్నాయి scars గురించి? Hi. Like what are the treatments can be done for scarring? Miro, like what kind of scars you have, or how many of you are struggling with acne scarring? Hi, hi, Kaushika ji. Yes, hi. Then what concerns you most about the acne scarring? Is it the pigmentation that is surrounding the scar, or the scar itself, or what treatments did you take till now for scarring? What was your experience with scarring? Jasvika ji, yes. Can you be like how? I yes. So how many of do you know what your acne scars are now? And what procedures did you get it done? How many of you have picked on your acne? Yeah, Jasvika ji, for the query that you have asked regarding that, uh, మీకు evaluate చేసిన తర్వాత we can tell you exactly how many sessions you will need. Initially we can start with subcision and TCA cross. Tarvata will see according to the type of scar you have. Accordingly, we'll assess and then we can guide you for that. Hi everyone. Hi, yes. So anyone has any myth or any questions that I want to that I can guide you better? Okay. Yeah. So I'll just tell you how acne scars can be prevented. So first and foremost, please don't pick or try. Like, see, everyone gets acne. It's not like only teenagers will get acne. In every age, we get acne. There is adult onset acne. There is like normal acne vulgaris. Then it can be secondary to chemicals, secondary to many things. But the most important thing is if you are suffering from acne and it's not coming down with in 7 or 10 days, then it's better always it's better to consult a dermatologist, for the expert opinion, so that they can guide you better, and so that the sequelae of acne, that is scarring, can be prevented. So my advice is, if you're struggling with acne, please do consult so that you don't get scarring later on, because scars is something which is kind of difficult to treat, but of course with modern technology it's like we can treat that as well. So, what can be done to prevent scarring? So, first is avoid squeezing your pimples. Then start the acne treatment early so that you don't get scarring. Then use the sunscreen daily so that it doesn't leave pigmentation. Then follow your skincare routine. The proper moisturizer, sunscreen, and use the creams and products that are suitable for your skin rather than very heavy occlusive creams. Hi everyone. Thank you for joining the Instagram live from Kolors Healthcare. Hi. So, what are the common myths that we have for scarring? Like, can home remedies improve deep acne scars? That is very common a myth that many people have. So, home remedies like deep scars usually require professional treatment. Home remedies won't be able to cure them. And apart from that, many people think that one session for the acne scarring, one treatment is enough. But the thing behind it is usually one kind of treatment works for one or two types of scars. But when you have a combination of scarring, then it's difficult to treat in one session. Then what other queries? Yeah, there is a message. Can scars disappear completely? Yeah, you can see significant improvement in the scarring. Yeah, yeah. With proper treatment, you can see significant improvement. ఇంకా ఎనీ డౌట్స్ యూ హ్యావ్ ఇన్ హిందీ తెలుగు ఆర్ ఇంగ్లీష్ ఏదైనా ఉంటే ఎస్ హాయ్ హాయ్ ఎవ్రీవన్ హాయ్ సో హౌ మెనీ ఆఫ్ యూ పీపుల్ హౌ మెనీ ఆఫ్ us are suffering from acne scars like and what treatments you have taken till now yes hi yes so there is a question saying like is there any relationship of weight with acne. Yeah, of course, because if you're someone who is having usually in females, if you are above the BMI range that is above 25, where you are in the 30 or 35 range, then you might and then you will have to evaluate if you have any other things like you might be your periods might be irregular or you might have any endocrine abnormality or anything as such. So that will have a direct relationship with acne as well. Hi, yes, hi. Yes, someone has asked. Your your back. Hello. Yes, hi. Even my doubts regarding scarring, any preventive measures, any like treatments that you have taken, what did work out for you, what didn't work out for you, anything can be asked. Hi, hi everyone. So someone has asked what are the common places? What about high pigmentation? Yeah, so Durga ji, yes. So regarding high pigmentation, first thing is we need to evaluate what kind of pigmentation you have. Sometimes the pigmentation can be secondary to melasma that you see over your cheeks or తెలుగులో మంగుమచ్చ అట్లా చెప్తారు. సో కొంతమందికి acne వల్ల కూడా pigmentation వస్తుంది. ఎక్కడెక్కడ you will have wherever you had previous acne there you will have pigmentation. దెన్ సమ్‌టైమ్స్ ఎక్కువ ఫ్రిక్షన్ వల్ల కొంతమందికి ఇట్లా చేయడానికి హ్యాబిట్ అట్లా ఉంటది. సో, దానివల్ల గూడా you might have pigmentation. So we'll have to evaluate your pigmentation and then accordingly then we can treat it. Hi everyone. Yes. Hi. So someone has asked in the time undali between two sessions of any treatment. Yeah, so it depends. If you're getting two sessions of laser, then RBM YAG and CO2 laser, there should be a gap of 4 to 6 weeks because that is the amount of time మీ కొలాజన్ అక్కడ రీబిల్డ్ అవ్వడానికి అది రెస్పాన్స్ చూడడానికి చెప్పొచ్చు. సో మినిమం గ్యాప్ షుడ్ బి అరౌండ్ 4 to 6 weeks. If you're getting peels done, then minimum gap should be around 2 to 3 weeks. Then you can even combine like ఒక సెషన్ ఎర్బిఎం యాడ్ చేసి తర్వాత ఒక సబ్ సెషన్ చేసి and in the same subsession we can add PRP. అంటే మీ బ్లడ్ నుంచి ప్లేట్లెట్ రిచ్ ప్లాస్మా తీసుకొని సెపరేట్ చేసి we can just apply it over there and we can give injection in the scars as well. So you'll have very good improvement దాంతో. Hi everyone. Yes. So yeah. Yeah, so any questions or any doubts will be we'll be completing the live session in another 5 minutes. If anyone has any doubts related to their personal experience with acne scars, also you can just drop a message. Best product. Someone has written, please give best product to me suggest. Yeah. So for scarring, the procedures usually work better because scars are a bit deeper than what you see in the mirror. So for scarring, I think procedures will work better. Products you can just use a good sunscreen and a moisturizer. That is for the maintenance part. But ultimately for scarring, procedures are the go-to treatment. Either be it microneedling or depending on type of what scar you have, be it microneedling or subcision or PRP or laser therapy, we might have to evaluate. Based on that, we can suggest you treatment. Yeah, so we'll be wrapping it up in another 3 to 5 minutes. Any doubts? Yeah, another person has asked, shall we lose 40 kg in 6 months? Well, we have an excellent slimming team and we have you can just contact Kolors Healthcare. They'll guide you on this. Yes. Hi everyone. Hi. Any doubts? If we have what equipment we have? Okay. Yeah. So another person has asked this query: what procedures we regularly do here for acne scarring? Luckily we have all the top equipment here, like starting, and we do all kinds of procedures from subcision to peels to PRP to microneedling, LBM yak laser and CO2 laser. Like we have everything for this. Even if you have very deep scars, you can offer fillers in the scars after these procedures as well. Hi. Yes. Hi. So we'll be wrapping it up in. Hi, yeah, hi everyone. Yes. Any queries? Any FAQs? Yes. So any queries? Yeah. So thank you everyone for joining the live session. Signing off, I'm Dr. Rida from Kolors Healthcare. For any types of queries regarding acne scars or for any treatment guidance, we are here to help you. Thank you so much. Thank you everyone for joining our live. Thank you. Share.